But if you've got a serious disease, if you've got a malignancy, you've got runaway high blood pressure, you've got runaway lupus that's really causing distress in your body, you may benefit from a much longer fast, 2 or 3 week fast. And for that, you need to be at a center like True North Health Center in California, where experienced doctors can watch over you and make sure that that all is going well there. So that's a whole other dimension of fasting. But what I mentioned before, the time restricted feeding, or the short intermittent fast, those are available to everyone. The only folks who shouldn't do it are people with type 1 diabetes, pregnant women, kids, or if you're on medicines, you can't stop. You need to stop your medicines during a fast. They get potentiated.
So I'm glad you mentioned that, Dr. Klaper, because like people are having questions. So can I do fasting if I am type 2 diabetic, or can I do fasting if I have any chronic conditions like hypertension, or like, is it okay? So what are the situations I can fast, and what are the conditions in which I cannot fast?
Right, absolutely. Important questions. Type 2 diabetes, where the person's still making plenty of insulin, absolutely. You can just cut the medications in half, but it's best just to stop them. And the worst thing happens, your blood sugar goes up, but it comes down. It's not a terrible thing. If you're just for 72 hours, you can do without, if you're type 2 diabetic, you can do without the metformin or the insulin, and give your body a chance to clear out your insulin receptors, and you'll find you'll have better control of your diabetes after a 3 or 4 day water fast. The high blood pressure, absolutely, but you want to take it easy. Don't go out and chop wood and be real active there. You want to let that pressure come down. You can, and again, you need to tell your doctor that you're going to be doing this. Don't if you're on potent medicines for blood pressure, etc., let your doctor know you're going to be checking your blood pressure a couple times a day. You're going to be sitting home, taking it easy. You don't have to lay in bed, but to catch up on your reading or your video games that weekend. And a 3-day fast off of blood pressure medications shouldn't put you at any risk, and may well lower that pressure, so you'll need less medications when you come back. And with all these things, the important thing, as we stress again and again, the fast is very nice, but what really matters is what you eat after the fast.
Yes, you could be fasting or doing a wonderful weekend fast, doing time restrict feeding, but when you sit down to eat, you're eating all processed food and butter and cheese and meats, then you're still increasing the inflammation, and
it's shocking how quickly Cinderella turns back into a pumpkin there. The blood pressure goes up, the diabetes gets worse, the joints start hurting. The fast should be the stepping off place to a whole food, plant-based diet. This is a beautiful time to break the fast with vegetable broth or vegetable soups, and maybe with some watermelon chunks, and then get into your nice stews and soups and curries and plant-based entrees. But the important thing is the plant-based, the low-fat, low-salt, low-oil, plant-based diet that you eat after the fast. That's where the focus should be.